Okay, doctors and trainers, I'm going to show you a basic video of how you can easily use the handheld video for the athletes there. Now, what's really cool about these lasers is that it's not like you're going to have a bunch of different protocols for different conditions. We can use some basic settings that I'm going to send you in the PowerPoint of an acute injury setting, a ligament injury setting, and a scar tissue injury setting, and a brain setting for performance enhancement. And you can use any of those ones anywhere. The basic premise when we're utilizing these lasers is get you to get a stand, we'll put it in a stand or you can hold it, and we're gonna spread the laser beam out over the area of involvement. So I'm gonna use it as an example here, my model over here. This is George. If I can get you to lie down on your back. So let's say that we've got a quadriceps injury. Now, ideally, we'd want to have him in his shorts to have the skin exposed. But just for the purposes of the video, he's got his clothes on, but the best application is going to be getting it on the skin. So what I'm going to do is I'm going to take it and place it in a stand. And there are also stands that, like a phone stand that you get off the internet will also work. We're just going to click this in here. And when it comes to the application of it, we can take the laser beam here. I'm using the green and violet one. I believe you guys have the red and violet. Any of them are going to work the same way. We're just going to position that laser over the area of involvement. So regardless of where it is, this laser is going to hit the tissue. And unlike some of the high wattage thermal lasers where you've got to go directly just over only that area of involvement, these ones are going to spread throughout the tissue. So if we're going with a quadriceps strain, I like to get it to spread that beam out over the whole area of the involved tissue. Now, as we have this on here, we can also do other types of therapies. So many times I will take at the same time a tool like this, like a percussor, and work over whatever area where there may be some areas of adhesions, where the tissue feels knotted up, where you've got some trigger points, and we'll work that over at the same time. I like to do it at the same time because if we're doing therapies with a laser or if we do muscle activity with a laser, we see enhanced effectiveness. The other thing that we can do is, let's say if we have him sitting up at the edge of the table, we can actually do different leg exercises like leg extensions in a range that doesn't increase the pain. Time frame on here. I like to do at least 5 minutes. That's my minimum on there. If we can go longer, if that works out with your athlete or with your patient, I do like to go longer, maybe say a 10 or a 20-minute session if we can do that. If I'm dealing with an athlete that needs to get back as quickly as possible, I'm going to do this every day. Or I may do it twice a day if that's possible. If not, I'm at least going to do it once a day. Now, let's say he's got knee tendonitis. Okay, I'm just going to slide this up, okay, George? If we bring this area up here, and let's say you've got like patellar tendonitis, go ahead and drop that down. We can now, same thing. We can bring this down and we can apply it so that that laser is spread out over that area of involvement. Now, how big does it have to be? There's not like a minimum or a maximum on here. You could get it closer to that area if you want to concentrate it, but the important thing to remember about these high energy lasers is that the energy is also going to get picked up by the circulatory system, so we can get this to spread throughout the area. And that brings me up to another point. Let's say that your patient has a fractured ankle and they're in a cast up to this area. I would apply the laser above the cast near where the blood vessels are so we can get the blood vessels to pick up the energy from the laser and deliver it down to that area. Let's say that we have an ankle injury, an ankle sprain, similar type of thing. We can simply move this down and apply the laser in that area. Again, I'm going to go for at least 5 minutes. If I can do longer, a 10 or a 20-minute session, I usually prefer to do that, and especially if I need to get that athlete better really fast so we have a short window. What I also like to do in here is to do small ranges of motion that don't increase the pain. So for example, George, while you're lying there, can you just kind of flex your foot up, bring it back down, and then just go around in a circle. Just go around in a circle. The key thing is you can have them activating that muscle while the laser's on. The key thing is doing it in the range of motion that doesn't increase the pain. So that's a big factor for that. Let me pause this here. All right, now next section, because for that, whether it's a knee or an ankle or a hip, again, you just want to try to get that laser on the tissue, spread it out over the length of the muscle from the origin to the insertion, run at least 5 minutes. If you can do 10 to 20, that's gonna be more effective. You can stack whatever therapies at the same time. You can also do some movement at the same time. Let's say if we've got something like a calf strain. So those are also common. Same type of a thing. I'm gonna spread it out and run it. So whether it's a calf injury or let's say an Achilles injury, I'm still going to do the same type of a thing here. You could, for an Achilles, want to bring it and make it more concentrated just into that area. But again, unlike the infrared high wattage thermal lasers, we can utilize these to where the circulatory system is picking up the energy and delivering it to this tissue as well. So I do tend to usually like to spread it out and to hit not only, let's say if it's an Achilles, run from the heel all the way up to the calf. And again, like I showed you for a quadriceps injury, you can use a percussor, use your hands, ultrasound, electric muscle stimulation, anything at the same time. Hamstring is a real common question you guys have. So let's say we come up here to the hamstring. I'm gonna do the same thing. Ideally, I'd want him to be, in his shorts with as much skin area as exposed as possible. And here I can run the full length, going from the origin down to the insertion. Again, kind of bringing that beam back to hit the whole area. This is where the line generated beam comes in handy too, because let's say he's got a quadricep or a hamstring pull and a calf issue. We can now back up this laser to be able to hit the whole thing from the glutes all the way down to the calf here. I don't know if you can see that very clearly there because of the light, but we've got this going clear down to here. So that makes it very efficient to utilize. Now, if we're gonna go for, let's say he's got a low back injury, same thing, we can go here, and we can go either along the spine this way. I'm just gonna lift your shirt up a second here. We can go up in that direction, or we can also go across. Either one of the two can be effective ways of applying it. Let's go here. My big thing is I like to have the laser in the stand far enough away so that we can spread out over the whole tissue instead of just going on one different area. So again, this is how you use it differently than some of the high wattage, low energy wavelength lasers. With this being low wattage, high energy, we can spread it out over a larger area instead of having to go in one area for a short period of time and then move it in one area and then move it. So this really frees up your time also, whether you're a doctor or a therapist or a trainer, so that way you can be going and doing other things while the patient is lying here under the laser and the laser is hitting a larger area, and you're not worried about any kind of thermal burns or kind of doing too much of a dosage for them. You can also stack this again with electric muscle stimulation, PEMF. You can do any kind of sound wave types of technologies on there. You can even do flexion distraction kind of tables, decompression at the same time. And one of the things I like to do though too, let's say just even for performance enhancement, is to get the laser on the patient running all the way from the cerebellum, coming all the way down the spine. So I like to do this, you can do this with the patient passive in this position, and again, with the stand, it just kind of locks in there. You can have them doing types of activities, like you can have them doing any kind of back stretches at the same time. This will make it very effective. Any of the treatments though, your basic thing is start with at least 5 minutes. If you can do 10 or 20, that's going to be a bit better. If you can do some movements at the same time, that's going to enhance it. Let's show you, coming up here in a second, what we would do for a shoulder if you've got that like for one of your goalies. So now I want to show you, let's say with the shoulder. And again, ideally, if we can get this directly onto the skin, that's going to be the best method of application. But for instructional purposes, I'm going to show you here with the patient fully clothed. So we can get the laser, and again, I like to use the line generated beam. So here I'm having it go not only on the shoulder, but down the arm and up the neck too. I do like to try to hit the brain whenever possible, so that we can also stimulate the cerebellum, and I find that there's an enhanced effect with this. Now, as he's sitting under the laser, you can enhance the effectiveness too if we do different motions. So if the patient has a rotator cuff injury that's pretty severe, we can have him just go here and just do small little motions. And just do small motions that don't increase the pain. Or let's have you come and bring it all the way up here and back down and then up to the side and back down. And you can have them repeat and do that while they are under the laser. You can also have them do resistance band exercises or weighted exercises. Time and settings, again, we can use either that acute injury setting or the ligament setting that I'm going to show you, or even the brain settings. Any of those are going to work to decrease inflammation, stimulate the tissue to repair as well. The biggest thing we want to look at is, again, trying to spread that area out. We can get closer if we want. Let's say it's a pinpointed area. We can bring this down and focus the beam into a smaller area. If you really want to concentrate, let's say for an AC joint strain, you can do that. But I still do really like to hit the areas near it too, because you'll have the AC joint involved, but also the musculature too. So we can hit both of those areas here. And again, that 5, 10, or 20 minutes on there with these athletes. I like to do it daily, or if possible to do it a couple times a day. I would definitely laser them right before their event if that's possible. And for performance enhancement, we can place the laser here, so we've got it on the back of his head, hitting the cerebellum. Again, with these high energy wavelength lasers, the biggest thing we want to do is to activate different pathways in the brain, because unlike some of the lasers that depend on direct penetration where you've got to put it in an exact type of an area, our studies show that we can stimulate the whole brain, because as the laser gets absorbed by the circulatory system, it's going to diffuse throughout the brain, so we get a better impact if we activate them. So many times what I'll do is we'll do eye activation. So we might come around here with the patient and just have them do a cardinal fields of gaze. So follow up here, back down, over here, down here, and back this way, and coming in and coming out. Or focus on this point here, keep your eyes on it, turn your head to the left, and then turn your head to the right, and keep going back and forth. And so we might just have him focus on this while the laser's applied, or utilize an app, like an iPad type of an app that's a sports vision type of a training app on there, so that he's doing his vision enhancement while we got the laser on. We could also have the laser here while he's up and doing different balance exercises. So let me get you to stand up, George. Okay, just stand right in front there, and I'm going to change the angle here of the camera. So we're going to bring this here so you can kind of see how it's applied. So there you see how we've got it running all the way from the back of the head and down the spine. And so as we do this, we can do some different balance exercises with him. Like, let's get you to put your feet together. We can have him put his feet together, look straight ahead, and close your eyes. And we can check to see how his balance is. And he starts to fall, we can kind of give him some feedback, or have him do this while he's on a vibration plate at the same time. Go ahead and open your eyes. We can also have him stand, put one foot right in front of the other with the feet heel to toe here. Close your eyes, look straight ahead. And again, as he's on the laser here, we can give him a little feedback. If he starts to go, we can enhance his balance. Now you can get more advanced with the athletes. Having him stand on one leg. Go ahead and stop, George. That's great. All right, go ahead and have a seat. So we can have them stand on one leg and do with the eyes closed while we're doing the laser on there. We can have them do sports-specific activities too, where we've got the laser on their brain and on the spine while we're having them do different kinds of activities related to their particular position in there. The biggest thing is don't overcomplicate the lasers. Just get it on the tissue, 5 minutes to start, or 10 to 20 minutes on there. Do it on a daily basis for your injuries. If the athlete is not injured, get it on the brain like I showed you there, at least 5 minutes before they go out there to practice or at the end of it. The studies show you will enhance their performance. You should see a better speed, better field of vision, and better reaction time on there. If you doctors have any questions, you can feel free to email me at drgair@gmail.com, drgair@gmail.com, and I'm happy to help you guys out.